Chin. The chin and anterior mandibular line are supported by a bony structure, chin eminence, then the horizontal portion of the inferior mandibular edge. The importance, or conversely the unimportance, of this bony eminence characterises the general physiognomy of the anterior part of the lower face. The aging of this anatomical region is due to insertion of several active muscles, the depressor anguli oris muscle and the platysma muscle laterally, but especially the mentalis and depressor labii inferioris muscles, which border the chin fold, a real chin septum. The fixity of mandibular ligaments and chin septum, and to a lesser extent from solid muscle insertions, fat loss and sagging of chin fatty compartments. Any reduction in the chin region sagittally or vertically accentuates aging. Any increase in the chin region sagittally or vertically reduces aging. The main anatomical precautions of the oval injection concern the inferior labial coronary artery. If it has a particularly low anatomical variation, facial pedicle laterally as well as the chin sensory nerve. The position of the chin and size of the chin fold affect the physiognomy of the lower third of the face and aging process. In general, and respecting the overall facial structure, the chin is corrected to harmonize proportions vertically by increasing downward and/or profile orthogonalization with a forward projection. Correcting the overlaying chin fold must also always be corrected if it is sunken. Chin eminence is marked off by lateral edges. The needle is inserted in the middle of the first lateral edge and injections are made in the lower half of the chin eminence using a fanning technique. And then the same technique is applied to the other half from the middle of the contralateral edge. At the same point of skin, without removing the needle or changing its direction, the fanning technique allows to project the entire chin forward toward the bottom and fill the chin fold, if necessary. Injections can also be made using a bolus technique, when the loss of volume requires greater projection with a single bolus or two or more boluses in the central part of the chin. These boluses are injected in front of the chin for an anterior projection and in the lower edge of the chin for a downward projection. After disinfecting, make a pre-hole with a needle to the dermic-hypodermic junction and insert the cannula parallel to the cutaneous plane in the desired injection plane. Make the retrotracing injection by removing the syringe to obtain a linear and homogeneous Radiesse deposit. Without removing the end of the cannula from the skin, change its direction and inject as many new lines as needed. The adjacent product lines are fanned out while limiting the number of injection points. Massage and shape the areas injected to evenly spread the product. With Radiesse, the product deposit and correlated correction are assessed immediately. The chin can also be injected using a needle by these same techniques or using a single or multiple bolus techniques when volume loss requires greater projection. The results obtained using the Radiesse injection are as follows when correcting chin